Hi, everyone. We are so fortunate to be joined by Jeffrey Flaks, the president and CEO of Hartford Healthcare, for a COVID-19 Q&A. Thank you so much for being with us.
Hi, Taylor. Thank you.
We asked our viewers to submit questions. I think so many of us have a lot of questions and concerns about COVID-19, the impact that it has had here in Connecticut. So I'm going to read some of the questions that were submitted through our website to you to be able to get some answers.
Terrific.
Our first question, how the workers at your healthcare facilities are doing through this crisis, whether that be nurses, doctors, techs, cleaning crews, really everyone on the front lines of this fight.
Taylor, our team is so resilient. Seeing frontline workers in healthcare today, it's so inspiring. It's absolutely incredible. Their bravery, their courage, their excellence, the compassion and empathy they deliver care. We have so much to be grateful for in this community. So our team really is doing exceptionally well. They're standing tall. These are unprecedented circumstances and hard to imagine the things we're working with. But our team is showing their agility and their strength as they work through it.
What are some of the precautions that you've taken to ensure their health and safety?
Many. That's our first job. We have to ensure that we protect our colleagues, the people who work within our organization, our frontline caregivers. So we've put visitor restrictions in place very early, many weeks ago. We put restrictions in place around how our own staff enter the building, going through temperature checks. We've given masks out to every one of our staff members and people who enter our building to ensure that we have protections standing forward. We've also ensured that we've had tremendous amount of personal protective equipment in every instance. So we're doing everything possible. But I'll tell you, Taylor, even more than that, we have a 24-hour, 7-day-a-week colleague support center that we stood up. And at that center, if people need hotels because they want to protect their families and stay overnight in hotels, if they need daycare services, if they need help with basic personal needs, we have a team in place to help them. So we're doing whatever we can to support the people who take care of us.
So I think one of the best things to see is really the community support. There have been so many signs all over the state and the country as they go to and from work each day for what we imagine are incredibly intense and difficult days and nights. How does it feel to them to be able to see that kind of love and support in that capacity?
Oh my gosh, it makes such a difference. The acts of kindness are incredible. We celebrated over a week ago 1,000 acts of kindness. So we've received food donations daily throughout all of our facilities across Connecticut. We have received people making masks, companies making face shields, donations, large and small, from big companies to personal and individual donations. It's at every level, from seeing the police and fire go across and front all of our locations, Lifestar flyovers, all of these reminders of what it means right now during this crisis, the essential work that our frontline healthcare workers are doing. It means a great deal to them. And when they go drive to work and they see the hearts on every one of the homes, it lets them know we're in this together.
That's incredible. So this question now is from Karen. Karen said, quote, I read that there are now over 20,000 people who have been identified with the COVID-19 virus in Connecticut and over 1,400 deaths. That is a death rate of 7%. Originally, the death rate was expected to be between 1 to 2. And she wonders if any of the medical specialists that you are in contact with might be able to shed light on why it's running so high. And is that rate consistent with other areas in the country, or is Connecticut experiencing a higher percentage, and why might that be?
Yeah, I would like our frontline physicians who are closest to this to answer that question with more specificity. But what I can say is more than 80% of the patients who have entered our hospitals are successfully transferred to home. So we're having a significant number of wonderful successes. And at the same time, our hearts go out and break for the fact that there is, in fact, mortality with this virus. So we are working through it. But still today, when people get tested and there's positive tests, the vast majority of people are treated and cared for at home by their caregivers. And when hospitalization is necessary, again, the substantial majority of people are successfully cared for and treated in the hospital. So it is something that everyone is extraordinarily focused on.
The next question comes from Lewis and Rachel. They both wrote to us wondering about elective surgeries and when those might get back to being scheduled or taking place? Because I know that a lot of normal procedures that might have been on the calendar had to be rescheduled given everything that's going on.
So the nature of elective surgeries, meaning non-emergent surgeries, it's being discussed. And it's being discussed because healthcare is essential. And we need to ensure that our hospitals and our ambulatory surgery centers and the different places that we do procedures across Connecticut, these need to get stood up. It needs to be done safely. We need to make sure we have adequate and substantial personal protective equipment in place. We need to have good testing for the people we're caring for, as well as the people providing the care. But we don't have a specific date that has been set yet, but I'm hopeful, and I think it's important that we resume as soon as it is safe to do so, elective surgeries back within our hospitals and within our community.
What is the latest that you're hearing from your experts about when the peak will be here in Hartford County? We're hearing we're leveling off in Southern Connecticut, but that the peak may still be a little bit away for us here.
So we've been predicting the peak for April 27th. And we have a wonderful partnership with MIT. The Dean of Analytics at MIT, Demetrius Pertsimas, has done our modeling in partnership with Hartford Healthcare. And his model consistently over the last 2 months has called for the peak to be around April 30th, May 1st. And as it appears now, with the revisions, it gets reassessed every day with new variables. It looks like in the Hartford County area that we're targeting around April 27th. But of course, that is subject to change. There's so many different contributing factors.
So we're told Hartford Healthcare is working with the Connecticut National Guard and the state to open an auxiliary hospital at the Connecticut Convention Center. Do you believe that will be needed and that we could see patients there within the next month, or is your capacity fine at Hartford Hospital?
Well, first, Taylor, let me say that the government, Governor Lamont, his team, his chief of staff, Paul Mounds, his chief operating officer, Jessica Bell, they've been wonderful partners to the healthcare industry throughout this process. One of the very, I think, best examples is the expediency in which our state partnered with FEMA, partnered with the Connecticut National Guard to stand up auxiliary hospitals throughout Connecticut. So we have built within Hartford Healthcare a center in the Convention Center that has over 600 beds. We've built one at Central Connecticut State University that has approximately 200 beds. We really consider those insurance policies. So we're hopeful that we don't use them, but they are there and ready to go. And it's about being prepared. We have operating plans in place. We have staffing models in place. They're equipped and supported. So as necessary, they can be activated. But we're hopeful we can manage within our 4 walls of our facilities with all the additional measures we've taken as our first strategy.
There's been a lot of talk about a second surge in cases this winter that could come during the flu season. How are you and your system kind of preparing for that?
So it's a really important thing for us to pay close attention to. Our experts, our team, work at a local, state, and national level very closely. And we're so fortunate to have within Hartford Healthcare people who operate at the highest levels of their field. So we have good information. Our people are on the very front edge of research and innovation. So we are preparing. So we're preparing in terms of making sure that we have the right physical support in place in terms of our bed structure, our staffing competencies, our staffing pools in place, our bed allocations, but particularly around stockpiling where we can and where it's appropriate, our personal protective equipment. So we have an entire operating system in place that will ensure that should that occur, we will be in as good a position as we can be.
This next question is from Tom. He says that no one is asking this question. If tested for COVID-19, how long is the test valid? Is it only valid for that day? In a couple of days, I get exposed. Do I get tested again? Don't you need daily testing ability to know if you are free of COVID-19?
So that's one of the challenges and one of the risks as we look to stand back up Connecticut in general is how to provide testing both for a point in time and what type of assurances it provides into the future. So our capacity to both test people and then retest people becomes important. So testing as a whole will be essential unless and when we have a vaccine. So we're all working very hard to stand up as much testing as possible. The partnership we built with Quest is a tremendous opportunity for the state of Connecticut. We're adding over 2,000 tests a day here in Connecticut through that partnership. So we're going to have about an 80% increase in testing by virtue of that relationship. And I'm very confident we and all systems across the state are going to be adding more testing as time goes forward. There's more access to test kits, and we're doing everything possible to compete to bring them here to Connecticut.
So do you think that Hartford Hospital will get a rapid testing location like we've seen in New Haven?
So what we're doing here is we're building mobile testing, first of all. So next week, we're going to be piloting mobile testing where we bring testing into the community. But what we've done already this week is we've doubled the size of our existing testing capabilities on the Hartford Hospital campus. So we went, what we're really looking towards is actually doing about 900 tests a day in the city of Hartford, between what we'll do on the Hartford campus and what we'll do mobile testing in the community. So I'm comfortable we're going to do a very significant amount of testing here.
Okay. This question is from Melissa. She says, if I wanted to take a test to see if I have the antibodies, could I, even though I haven't been sick and didn't think I had any symptoms? I am a hairdresser and believe I have been exposed because of a few clients that were sick, but I never was sick myself, but I want to find out if I have the antibodies. So can I just go and take a test?
So antibody testing is emerging, and it's an emerging science. And first of all, it's a blood test, so it doesn't have some of the logistical challenges that the viral testing does. So when you're doing blood testing, we can do it in any one of our offices, in most instances around Connecticut. And we could set up centers that can draw blood through traditional phlebotomy mechanisms, no different than when people get their cholesterol checked. But so we can acquire the blood specimens and do that testing with ultimately over time, I think, a more substantial a number. So that testing will be available. The questions around it, though, are still, given that this is such an emerging science and this is a new virus where there's such little confidence, full confidence around what to anticipate, is what level of immunity people will have from COVID-19 and how long that immunity will last. But it's being studied at every level of our country today, and we hope to have answers to that very soon. So as those answers become more clear, aspects of this type of testing will be important, and it'll be part of how we restart our economy, both here and globally.
And you highlighted it a lot in your last answer, but we did get multiple questions about antibody testing. So I guess moving forward, what kind of role do you think it will play in this pandemic?
Yeah, we believe that antibody testing will be important. It's going to be important because it'll tell us, again, there's many people who may have been asymptomatic, have had symptoms, or people who were sick and are now, past that, and it can confirm that they have these antibodies. And over time, what we have to learn is, what does that mean? What type of immunity does it provide, and for what duration?
Can you talk to us a little bit more about convalescent plasma, what exactly it does, how it works, and has it been shown to have any success?
So again, another innovation, another example of just the brilliant minds working across the world on how to combat COVID-19. But convalescent plasma is where people who had the virus, ultimately successfully shed the virus, are able to donate their plasma, and then that plasma is given to patients who are currently ill. And the indication is that plasma donation will help people cure more quickly, more successfully. So again, it's in its very early stages, and it's being studied very carefully from a safety perspective. But we are accepting plasma donations here within Hartford Healthcare. We have administered it on a number of patients.
This next question is from Susan. She says, with all the news of the state opening more testing sites, she is curious as to how this is preparing the state to open. She understands that those who test positive will then be able to have loosened restrictions, but shouldn't the state be pushing for antibody testings to see who has had it? I get the sense that people are being tested with no symptoms just because it's available. If they test negative, how does that benefit anything or anybody?
So how we reopen the state is a very challenging set of circumstances. Governor Lamont, I think, is really leading this effort very strongly, but he's also working now with a association of 7 different states, because this virus doesn't respect borders. So we have to be thoughtful about how our coordinated efforts with all the surrounding states as we make these important decisions. So there's many different considerations being given, both around how we test for the virus, how we do antibody testing, what type of precautions are put in place, how we graduate different services as they get stood up. And the task force around reopening the state that the governor put in place, I think, is very well situated, working collaboratively with other states to ensure at Connecticut that we're making good decisions. But up to this point, at the same time, Taylor, if you look at our social distancing, I think it's been essential. You can see that it has worked in many ways as we're starting to see the plateau of COVID-19 within our regions. So we have to continue to be very vigilant in following these guidelines.
Now, we've heard from the governor that increased testing will be needed across the state before it can reopen. And Hartford Healthcare, which accounts for around 20% of the tests in the state, announced a partnership with Quest to increase testing. Can you talk to us a little bit more about that?
Yeah, this is an incredible partnership with Quest. So we've been partners with Quest Diagnostics since 2014. They operate the commercial laboratories on an outpatient level for all Hartford healthcare facilities. So we were very well positioned when we approached Quest Diagnostics and said we wanted to substantially innovate and use our ingenuity to substantially increase testing in the state of Connecticut. And as a result of this partnership, we're increasing today the testing in Connecticut by 80%. So we're moving from about 2,600 tests a day that will be just north of 4,600. So it's a very important advancement, and the partnership will allow us to distribute tests in the community, improve access, and hopefully be a major step forward to how we can start to look to reopen this economy.
I know it's difficult to kind of talk about the timeline, but when do you actually believe we will be able to reopen the state?
I think the governor has been clear that he's been focused around May 20th for a whole series of important decisions that are coming in the near term. So we're working closely with the governor. He's been incredibly inclusive, incredibly responsive, and his team has really worked in partnership with the healthcare industry in an unprecedented way. And one thing I've been most impressed by is how pragmatic the governor has been in his decision making to help remove barriers, help step down regulations in a time of crisis. So I think he's going to make sound decisions. I think he has very good advisors around him, but it's unclear. We have to look at the data. We have to see the trend go forward, and we have to continue to evaluate what the incidence levels are within our region as we're able to make those types of decisions.
Well, and when that does happen, what do you think it will look like? I think that's one of the biggest questions that a lot of people will have. Like, will we be able to return to normal life? Will restaurants and gyms and hair salons be safe to open? What are your thoughts?
I think that's what the group is studying today. So the return to work task force that the governor has set up, they're looking internationally, they're looking across the country, and they're working in partnership with those 7 states. So I think they're really identifying what are the safest and best practices. My personal perspective, I think it'll be graduated, and we need to be thoughtful about kind of incrementing as we bring back the economy so that we can ensure that we can both do it safely and modulate it as it's going forward to make certain that we're able to contain the virus and the tremendous gains we've had for public safety.
So looking ahead to the next week or two, what do you think some of the biggest challenges you're facing are?
As we look in the next week or two, we have to watch very carefully the data. So first, do we really reach kind of the peak of that curve and it starts to flatten out? And, I've talked often about the fact, these are not numbers, these are not statistics, these are people. So we're so focused on people and ensuring that we ideally are going to be caring for less and less people with COVID-19 as each day passes. So first and foremost, we have to see how many people we're caring for every day. Secondly, we have to really closely monitor the amount of testing we can do and what that testing is telling us. So that will be critical. So I do believe those are going to be the 2 areas that get focused on most closely over the next number of days.
What is the biggest message that you have for the public in terms of helping people to, stay informed and be prepared?
So first is gratitude. We have enormous appreciation to the public, the amount of partnership, the togetherness. We're in this together. It's never been felt more than it is right now. It's what makes Connecticut such a special place to live, to work, to raise families in. And it's been so gratifying to see that. So we want to express our tremendous appreciation for the support that all healthcare workers are experiencing. But as we look forward, I think it's very critical that we stay connected to. In our case, we have a 24-hour, 7-day-a-week hotline. So people who are feeling symptomatic, people who have concerns or questions, anxiety, call that phone number, 1-860-972-8100, and they can speak to a clinician 24 hours a day, 7 days a week. So we want to make sure we stay closely connected. We get people access to the care and services they need as immediately as possible.
Absolutely. I mean, I think it's incredibly important that we now have the ability with that kind of technology to be able to talk to our doctors and ask those questions, especially if you just maybe have a general question about something unrelated to COVID-19 that you don't want to take a trip into the doctor's office for.
Right. Telehealth is a tremendous innovation. We've been doing telehealth 4 to 5 years at Hartford Healthcare. We were one of the earliest health systems in America to do it. But up to this point, it's been a very slow migration. But what this crisis has created now is an impetus for treating people at home. And we're now doing 3,000 to 4,000 visits every day of telehealth. So we're seeing tremendous advancements. We've done over 50,000 telehealth visits. So it's been incredible. In many ways, within COVID-19, one of the things that is an outgrowth of it is innovation. So we're seeing all types of new ways to do things. And in many ways, we shouldn't return back to the way things used to be. There's going to be lessons learned from this and new advancements that we're going to want to carry forward into the new normal.
No, I think a lot of people want to help in a time like this because I think many of us feel helpless and want to be able to do something and give back. What is the best way that the community can support you right now?
So we've set up a system. You can go to our website, hartfordhealthcare.org, and we have a team of people who are standing by, manning phones, available to speak to people in the community who have ideas on how they can contribute, participate, volunteer, help. We've seen tremendous creativity, enormous support, and it's been very important to us. So how we galvanize all of the resources and capabilities in the community to help us fight this crisis is really critical. So I urge people to go to that website, call our team, bring their ideas forward. We love to hear them. We love to discuss them. And we're hopeful in many instances it really leads to making important contributions to this fight.
Well, I just want to say thank you so much for your time. I can imagine that things must be incredibly busy for you, but we appreciate the fact that you were willing to answer so many of the questions that we received through our website. So thank you. I appreciate it.
Thank you, Taylor. My pleasure.